Hi, and welcome back to the Chasing Care podcast. I'm your host, Gavin Chase. On the podcast, we break down the complex world of care, making it easier for you to make informed decisions. Today, we're building on a previous episode about paying for home care in the UK. Specifically, we'll dive into two important financial tools. The first one is direct payments from your local authority and NHS continuing healthcare. Both can significantly reduce the financial burden of home care, but they do work in different ways. So, whether you're a carer or somebody who needs home care yourself, stay tuned to learn how these options can support you. Let's start with what are direct payments? If you've had a care needs assessment through your local authority, one of the payment options they may offer you is direct payments. These are essentially cash payments that go directly into your bank account, allowing you to manage your own care services instead of local authorities arranging it for you. Who can get these payments? They're available to disabled people over the age of 16 or with short-term or long-term needs. Also for disabled parents needing children's services. Also carers, including those responsible for disabled children, and elderly people requiring community care services. Here's the beauty of direct payments. You get to choose how that money is spent. You could hire a professional care worker or even use it to buy equipment that supports your care. However, keep in mind that the payments can't be used for everyday expenses like rent, utilities, and groceries. The amount you receive is decided after your needs assessment, and the council will check in periodically to ensure that you're receiving the right level of care. But why might you want to consider direct payments? It's all about flexibility. You can tailor your care based on your care needs, and you're not locked into a single service provider. However, with that flexibility comes responsibility. You'll need to manage the payment, and you'll need to ensure that the care is properly provided. It's also important to note that direct payments do not affect any other benefits you're receiving or entitled to, so you don't have to worry about losing financial support from elsewhere. Let's turn our thoughts to NHS continuing healthcare. What is it and who qualifies? So another important system for people with substantial care needs is NHS continuing healthcare, or NHS CHC. Unlike direct payments, this option is funded by the NHS and isn't means tested. That means that you don't need to worry about your savings or income when applying. NHS CHC is designed for people whose care needs are primarily health-related rather than social. If you're dealing with complex medical conditions and require substantial long-term care, this could be a great option for you. How does this process work? Well, it starts with an assessment, a checklist of 11 care need categories that healthcare professionals will use to determine if you might qualify. If you pass that first stage, you'll move on to a full assessment conducted by multidisciplinary team of healthcare professionals. If indeed you qualify, NHS continuing healthcare will cover the full cost of your care, whether this is in your own home or in a care home setting. And don't worry, the NHS will review your care needs regularly, so you'll continue receiving the appropriate support. If you're ineligible, don't despair. You can appeal the decision, and the appeal process is very straightforward. Just make sure to follow the steps outlined in the decision letter. Now let's take a look at the benefits to help you cover the cost of home cares. Now, when I talk about benefits, even if you're receiving direct payments or NHS continuing healthcare, you may still be eligible for other benefits that make managing the cost of care easier. Let's take a look at a few of them. First one, attendance allowance. If you're over the state pension age and need help with daily tasks due to disability, you could receive between £72.65 and £108.55 per week. The exact amount depends on how much care you need. Secondly, personal independence payments, or PIPs. For those under state age pension, a PIP is available if you had difficulty with daily living tasks for the last 3 months and expect those issues to continue for another 9 months. You could receive between £72.65 and £470.38 per month, depending on the severity of your needs. And lastly, there is a carer's allowance. If you're providing at least 35 hours of care for somebody else, you could get £81.90 per week in carer's allowance. This is especially helpful for family members who may not have realised they're eligible for any financial support. As I said, these benefits can work alongside direct payments or NHS continuing healthcare to ease the financial strain, so make sure you check your eligibility. So, to wrap it all up, let's quickly look at the tailoring of care and payments. The big takeaway from today's episode is that you have options, whether you're managing your care through direct payments or qualifying for NHS continuing healthcare. There are ways to make home care more affordable and tailored to your financial needs. The key understanding is the criteria for each type of support, being proactive about your assessments and knowing what benefits are out there to supplement your care plan. If you want more information on direct payments, NHS continuing healthcare, or any of the benefits discussed, check out the links and speak to a quality care advisor. As always, be sure to subscribe, like, and share this podcast with anyone who you think might benefit from it. Thanks for tuning in. My name's Gavin Chase, host of Chasing Care podcast, and we'll see you next time.